protecting our community from COVID-19. Greetings, I'm Eric Eller, President of the African American Men of Westchester. AAMW is a not-for-profit organization. It was founded in 1987. Our membership is made up of African American men who have distinguished themselves in fields of finance, government, business, education, law, engineering, real estate, technology, and a wealth of civic and community activities. AAMW is committed to developing and encouraging collaborative action to strengthen the economic, social, and educational foundations of our communities. AAMW believes in partnering with those organizations and individuals who share our vision and goals and leads to the greatest success. Today, we're partnering and sharing information and knowledge on how to protect our community from COVID-19, and we're partnering with Mecca Santana Mitchell, Senior Vice President of Diversity, Community Engagement at Westchester Medical Center. Mecca?
Eric, thank you so much. Good afternoon to my fellow participants and to our audience members who are going to be able to view this information later on. As you just heard, my name is Mecca Santana Mitchell. I'm the Senior Vice President for Diversity, Inclusion, and Community Engagement for WMCHealth Network. We are a 10-hospital system located throughout the Hudson Valley region with facilities in Westchester, Orange, Rockland, Ulster, and Dutchess counties. And, you know, for us at WMC Health, we recognize that keeping communities healthy and vibrant has just as much to do with what happens outside of hospitals than what happens inside of hospitals. And with that in mind, we then endeavor to create strong and lasting partnerships with our external stakeholders, with community-based organizations like the African American Men of Westchester, with our faith-based institutions, with our academic partners, with businesses, with nonprofits, with government agencies, really in a way that creates sustainable health and wellness. We partner in ways that create that lasting wellness. We partner in ways so that we ensure that the care that we're rendering is culturally competent and that we're exercising cultural intelligence as we offer patient-centered care. We endeavor to increase access and ensure equity. And at the end of the day, we're always trying to be as responsive as possible to the communities that we serve. And really consistent with that mission, we're so pleased to be partnering with the African American Men of Westchester to bring you this COVID briefing. Facilitating today's discussion will be the co-chairs of the Health and Wellness Education Committee for the AAMW, and that's S. Hassan Bilal and Edwin Bowman. Mr. Bilal is the president of the Bilal Group, a wealth management firm located in Tarrytown, New York. Mr. Bowman is the founding principal of Bowman Becker Consultancy, LLC, a firm dedicated to human resource management. Mr. Bowman is also an adjunct professor at Manhattanville College in the Department of Economics, Management, and Finance. And as a guest speaker for his class previously, I can tell you he is a phenomenal educator. And we are really thrilled to be joined in today's conversation by Dr. Renee Garrick, Chief Medical Officer for WMC Health Network. In that role, Dr. Garrick oversees quality, safety, and regulatory initiatives. Dr. Garrick also serves as the Vice Dean at New York Medical College. She is the Medical Director of Dialysis Services. She is a member of the Healthcare Association of New York's statewide Quality Committee, and she serves on the New York State Department of Health's Committee on Office-Based Surgery Safety. I have had the pleasure of working very closely with Renee on diversity issues and community issues over the last several years. She is a true champion for patients and communities, and I thank her for taking time out of her busy schedule to be here with us today. With that, I will turn it over to Hassan and Edwin. Thank you.
Yes, thank you, Dr. Garrick, for being with us today. So the first question that we have for you is this. For those who aren't as familiar, can you share some basics about the coronavirus? How it is spread, what is the impact on the body, how long does it stay on surfaces?
Well, first let me thank you for inviting me to participate in this today. It's a great opportunity for us to have a chance to talk to the citizens of Westchester about this clear pandemic. To give you a little bit of background, so this coronavirus, or COVID-19, is a cousin of other coronaviruses, but it's actually very different. We're learning. So it's a respiratory virus, and it's spread by droplets, and that's why people can wear masks to try to protect themselves from spreading it to others. We don't know exactly how long it lives on surfaces, but we have an idea that it depends a bit on the type of surface. So cardboard might be a few hours, whereas stainless steel might be a few days. And that's one of the reasons why we keep stressing hand washing and surface decontamination, because there's a lot that we're still learning about the virus. We know in this country that the manifestations are probably a little different than what was seen in China and a little different than what was seen in Europe. What we're not sure about is that because the virus changed a bit as it traveled, or is it because our healthcare reporting and our healthcare tracking is at a point where we're detecting things that maybe didn't make the news in other countries. So in this country, what we know is that the early symptoms of COVID may be nothing. So that's part of the problem, is that a large number of people with COVID have no symptoms, or they have a little cough or a little sore throat. They may not have a big fever. That's why testing is so critical, because you may have it and not know that you have it. And that's really important if you're young, and that's why we keep worrying about youngsters spreading it to their families, because they may have no symptoms. In older populations, the symptoms are typically those of respiratory illnesses. So a cough, a sore throat, a fever. Interestingly, people lose their sense of smell. So in the clinical world, we ask people now, have you noticed any change in taste or any change in smell? We don't know exactly why that's happening, but we know the virus does enter the body through the nose. And we think the viral particles may actually affect the fibers that then transmit that to the brain to actually create smell. Muscle aches and pains are a huge part of the symptoms. People complain of severe fatigue, too tired to get out of bed, and very high fevers. And it's been startling to the medical community. People can have trivial fevers, or people can have fevers of 105 degrees. So there's a real panoply of how this presents, and that's been one of the challenges. It is not a typical influenza-like illness where everyone's the same. People can present with a whole myriad of symptoms, and you need to kind of be vigilant about what those presentations might look like. In terms of the things we want people to be aware of, they're personal hygiene, hand washing, wearing a mask when you go out, washing surfaces that you may have touched is critically important, because it's spread by droplet, which means if you cough, if you sneeze, if you laugh loudly, you can spread the virus. So we're really trying to help people understand the importance of protecting yourself and your loved ones and community members from the spread of the disease. One of the questions that's come up a few times is, will this have long-lasting damage? If you get COVID and you recover, will you have any kind of lingering symptoms or lingering damage from the virus? For most people, without question, they will be fine. The vast majority of people who are getting this are home and recovering and doing well. For people who get more severe illnesses, we don't yet know if they will have any lasting problems. In China, people have had lasting pulmonary diseases, and we are setting up ways now to track those patients, because we want to stay on top of that. And certainly if people do have residual damage, we want to be here to provide them care and assistance with that. We don't yet know how that will all transpire. So lots to learn.
Good afternoon, everyone. Dr. Garrick, when it comes to protecting oneself and others, there are many different methods, as you just went through for us, being employed, like the social distancing and wearing a mask and repeated hand washing. But also, when it comes to the mask, I want to focus on that for a second. When it comes to the mask, people are wearing different kinds. And so I wonder if you can share some insights with us about the different types of masks or other facial coverings and the type and the levels of protection they provide.
Sure, absolutely. That's an excellent question, especially now, because you can go out onto the internet and buy just about anything, and people are wearing masks that they make at home. People are buying masks I saw yesterday with little holes in them, and they're called, easy breathing masks. Those may not provide any protection at all. It depends on how they're actually manufactured. So There are masks that we use in the clinical world that are basically of three types. There are masks that are just simple little procedure masks that have minimal protection except for you not making someone else ill. Then there are surgical masks that actually have a higher level of protection and protect you to some extent from getting ill of something just as a simple droplet. And those are the masks that you see people wearing widely right now. And those are actually surgical masks, the same kind that can be worn in the OR. Those provide protection from you making someone else ill. The fancy masks, the ones you hear about on the internet that there was a shortage of in some institutions, thankfully never our institutions, are called N95 masks. And those masks get that fancy name because they protect us from 95% of the particles. And that's why they have that label of N95. Those masks prevent you from getting sick and they prevent you from spreading illness. But they're very special masks because they prevent us from getting ill, not from typical droplet contamination. Surgical masks are fine for that. They protect medical workers from getting ill from truly aerosolized particles, which is a different level of particulate contamination. Those are really small particles that travel further. So in medicine, when we're talking about wearing an N95, we're talking about wearing those kind of masks because a patient may be having a procedure that results in a lot of aerosolization, like if you're doing surgery on the mouth, or if you're intubating a patient because they've had a complication that requires them to be on a respirator. So those special N95 masks are really meant to prevent the wearer from getting aerosolized particles into their body. For the vast majority of people, surgical masks are fine because that will protect you from getting ill from a droplet, and it will protect you from sharing the disease by coughing or sneezing. And you can go on the internet now and watch. They have all these amazing videos of black lights, and you can see that if you cough without any protection, you can go, 3-4 feet. If you wear a mask, it's contained right by you. And there's a huge importance of wearing those masks. And we're worried because a lot of what's being sold out on the internet will not turn out to be protective. For example, if you see masks with that filter on the front, that's probably not protecting the public. That might protect you, but it will allow you to spread it because that filter lets air out. So N95s don't have, real perfect N95s don't have that filter unless that filter itself has an additional particulate filter. So if you're careful and you know which ones to buy, it's fine. But some of the things that are for sale on the internet with that open filter are not actually doubly filtered. So there's a lot that can go wrong. And some of the masks that are out for sale with holes in them and things are probably not the best things to buy. So I would stick to trying to buy ones that are appropriately labeled as surgical masks or as N95 masks, and maybe not so much of the colorful ones that look pretty but maybe not serve the same purpose. But you're right, there's a lot of news out there and a lot of possibility of being misled.
Thank you. Doctor, there are many myths and misconceptions out there about the coronavirus. For instance, if you come down with it, drinking warm water or inhaling steam or ingesting disinfectants, what are your thoughts about this type of information floating around on the internet? And where do you recommend people to go to get reliable information?
So that's a great question. So in the beginning, I think people thought Corona beer was the way to kill this virus, but then we went through warm water and all kinds of other things. And the reality is there's a lot of misinformation out there. We don't yet have a cure for coronavirus. I wish we did, but we don't. And that's very typical for this family of viruses. Remember, the common cold is a coronavirus. There are many coronaviruses out there. In fact, we test something called the multiplex that we do routinely and have done it for years. So when someone comes in with a viral-like illness, we've been doing this multiplex for years, and it has coronaviruses on that multiplex. This corona is this novel thing called the novel coronavirus because we don't have clear-cut ways to treat this. We urge people to get reliable information from websites like the CDC or the New York State Department of Health. The Westchester County website, which is partially run by Dr. Ambler, who's the Commissioner of Health, has excellent information about COVID-19 and the COVID virus. The FDA website, the CDC, those have very reliable information. We are terribly worried about people getting ideas that they should do things that are not only of no value, but could be dangerous. And, you know, the idea of getting medicine on the internet because someone tells you that if you ingest silver, it will cure you is just blatantly untrue and could be absolutely lethal. So we're really worried that people could be misled. There's a lot of emotion, a lot of fear around this, and you really need to be thoughtful about where you get your data. A lot of things on YouTube that are just silly. In fact, there have been some arrests in this country of people peddling false information about cures. And we've been very, very concerned about it. There are people opening infusion centers saying, come to my infusion center, I'll give you this medicine and I'll protect you from coronavirus. That is absolutely not true. There's nothing to support that kind of misinformation. And I would try to go to very reliable websites. The medical center has a website. We post a lot of information about COVID-19. There are other agencies like regulatory agencies that have lots of information about COVID, and that's where we should be directing patients to get their healthcare information, not from sort of common popular science. A lot of damage can come from that. Although I did like the idea of drinking warm water, but I don't think it will cure COVID. Right? Wish it was that easy.
Dr. Garrick, usually when someone starts feeling ill, their first inclination is to run to urgent care or an emergency room or head to their doctor's office. With this virus, things seem to be different. So can you tell us what the best course of action is if someone starts running a fever or otherwise starts showing symptoms?
And thanks so much for asking that. So, you know, when this pandemic first struck, the emergency rooms were overrun with patients. In Westchester alone, there were over 30,000 cases with COVID. And you are absolutely right. The message was sent out to people, don't just run to the ER if you have a temperature. Let's do an assessment first. Let's make sure that we can take care of you in another area rather than coming to an ER. And there were three really big reasons for that. The first was we didn't want patients to wait for long periods of time close together and therefore spread the disease. So we wanted there to be a way to not be clogging up the ER with hundreds of patients and spreading the illness. The second was that most of those patients, the majority, will be okay because most people do fine with it. And the third was that we didn't want to be accelerating people's fear and creating unnecessary emotional, have an overwhelming emotional impact. So we said to people, stay at home, call your practitioner, call our hotline, let's get some information first, and then we'll help you decide what to do. That was done during a really heavy part of the COVID experience in Westchester and also around New York City. And now that we're past that peak, now we want people to understand, if you have symptoms of an illness, we are past the peak of COVID. There's a good chance it's not COVID. So if you get chest pain, or you're short of breath, or you have other symptoms that you normally would have gone to the ER to seek care about, you should go. Because we're at a different place now. And what we've discovered is that a lot of people did avoid going to the ER, and they had ailments perhaps other than COVID. So patients with chest pain or shortness of breath need now to understand that it is not only perfectly safe to go to an ER, we need you to go to an ER. We don't want you to avoid care. In fact, we're part of a study now in New York State looking at cardiac patients who may have needed to get care and avoided ER. And we're comparing the number of people that we saw with heart disease during COVID to the before and after period of COVID to see what kind of impact it had on other medical conditions. The other thing I would add to that is I think it's very important for your group and for the Westchester community at large to know that as the trauma center and as the children's hospital and as the cancer center, this institution never, ever was in a situation where we were unable to accept patients. So our doors have always been open. We basically ran sort of two hospitals, the COVID hospital and the non-COVID hospital. So we always were able to and always have had capacity to take care of patients with other underlying ailments. And we need the community to know that that is open, safe, has capacity, because we don't want patients who have underlying neural diseases or stroke or cancer or heart disease to stay away from the hospital. We want people to know that we're here and more than able to take care of them fully, have full capacity to provide that care. And we need to get that message out to the Westchester community loudly and clearly. It's very important, especially for high-end advanced care.
Dr. Garrick? We have been hearing a lot in the news about the fact that the coronavirus is having a greater impact on the African American community. Why is that, and how do we reduce these disparities going forward?
So this has been a really worrisome issue. If we look at the available data in this country, the African American communities and the Latino communities have been absolutely disrepresented in terms of the numbers of patients that have been diagnosed with COVID. And unfortunately, it's also the number of patients who've gotten seriously ill from COVID. So it's raised a lot of questions about why would this be? One of the things I think we need to be really careful about is we shouldn't pounce on one answer. We need to be very open-minded about why this could be. Clearly, there are data that suggests that the presence of underlying comorbid conditions like diabetes or high blood pressure, obesity, may be risk factors for developing serious illnesses with COVID. However, if you look at the communities, respiratory illness itself, like underlying COPD or pneumonia, is not more common in the African American and the Latino population. So leaping to a conclusion may be detrimental because it may get in the way of our actually being open-minded and looking at all the circumstances that could be leading to underlying issues. For example, healthcare disparities are something we have to be very cognizant of, and we have to look at each one of those issues and say, is it a problem with access to care? Was there a problem with the ability to have social distancing, or the ability to have patients who ultimately got COVID, were they overrepresented in terms of the population of essential workers? So we have to look at each one of those factors regarding social disparities. We have to look at the factors looking at underlying comorbidities. We have to understand that, for example, as I started to mention, influenza, which is clearly a respiratory illness, does not track along racial lines, but clearly there's something about COVID that is. And we have to look at each one of these areas carefully and thoughtfully, and not just say we think we have the answer, because if we don't look at them thoroughly, we could accidentally miss something very, very important. So our group has been trying very hard. Actually, we're developing a very large, what we call our COVID database. And we're taking all the data in our network, which now has over 1,000 patients, and we are analyzing and putting all the data together so that we can seriously analyze the demographics of this illness, the social issues of this illness, who got sick, why they got sick. And we're even trying to ask questions, for example, about were people able to do social distancing? Are we able to track exposure so that we can try to get a better understanding of how the different communities have been negatively impacted by this illness? And I think it's extremely important to be very open-minded and look at each one of these areas critically so we can better understand what is clearly the data is pointing to, which is that there is a disparity in the numbers of African Americans and the numbers of Latino that have been impacted by coronavirus, by this particular corona. Absolutely, very important. And if I could kind of have an additional add-on on that, one of the things that we've just started to learn about is this disease in children. And, you know, for a long time, people were saying, oh, COVID doesn't bother children. And in the last week in our hospital alone, we've had 12 or 13 children who've been afflicted with a disease that appears to be happening maybe a month after COVID. It's not clear to us exactly what this is, but it is very important, because if you think about this, if a higher population of one community was afflicted with COVID, and if it's true that maybe their children were also afflicted, we have to watch carefully to make sure that the entire community is appropriately screened and appropriately protected. I know there's been a lot of talk in the news about how schools should be reopened, et cetera, and this doesn't affect children, but we need to be humble and reserved in our true appreciation of the fact that there's a lot we don't know about this virus, and we need to be really vigilant about watching over our children and making sure that we are not missing something critical in various communities at risk. So you can tell I feel strongly about that. So.
Dr. Garrick, we appreciate your sharing. Just one more. Can you share some information about the testing that's being offered by Westchester Medical Center Health and other efforts being taken by Westchester Medical to support patients and communities at this time?
Sure, I'm happy to. So when you think about COVID, as I said in the beginning, since a lot of patients are asymptomatic, you really have to know who has the disease. So that's the initial part of actually detecting the virus. And that was done in our center by nasal swabs, which were better than saliva and other ways of looking for the virus. And this virus is called an RNA virus. So that's just the type of virus it is. And you can actually detect it. And you can do a very fancy immunologic test to find the viral particles. And we, back in early March, we began a drive-through tent that had 4 lanes, and we could test, I think on our biggest day, we tested nearly 1,000 patients. So in our tent, we've tested close to 30,000 residents of Westchester, which is a pretty good number considering the county has tested a little over 100,000, maybe 110,000 or so, that we've done a huge amount of that on this campus. The reason why that's so important is you need to know who's got the disease. So you can figure out who they might have exposed to the disease, and you can also then help them take precautions about getting a more advanced level of illness themselves. So that's a good part of public health for finding out who's got it. Because a large part of the population was asymptomatic, then there's another study you can do that's an antibody study that actually looks back to say, rather than I have it right now, detecting for the presence of active virus. It says, is there a way to say, did I have it? And that's called an antibody. Because when we're ill, we can mount this antibody response to the virus, and that antibody can then be detected in our blood. And we do the one that's detected by drawing a tube of blood, so it's got a high level of sensitivity and a high level of specificity, which in English means if you had the virus, we're going to find the antibody in you, and we're going to find the right antibody. So not to some other COVID, not to some disease like measles or mumps, but to COVID-19, and we'll find it in your blood. So that we set up doing here initially, and we did our staff, and I think we did probably close to 2,000 staff members, and then we went live by doing it in the county, over in the county center. And there we've been doing initially the first responders. And in terms of the antibody studies that we've done there, we've done about 7,000 antibody tests now overall. And the overall response rate that we've done in our hands is about 9%. If you look at the total population of the antibody levels done in various groups, there's a range on that, so from 7 to maybe as high as 13%. And that's very, very important because you want to find out who was at risk, who got it, where are they now, and how are they doing. And that public health piece is critically important for deciding, are we reaching levels of immunity that will help protect the population? The other big thing we're working on now with the antibody is how good is it? So, there are diseases that we can mount an antibody response to, and the antibody can last for life. Like measles, for example. Most of us probably had measles when we were kids, and that antibody is with us forever. Then there are other diseases like chickenpox, where we might have had it for kids, and now we're all getting boosters because the antibody fades. And then there are other antibodies that actually don't protect. We don't know yet about this antibody. So we don't know if it's a protective antibody. We need to learn that. And we don't know how long, if it is protective, we don't know yet how long it's going to last. So each one of those stages has to be evaluated. So first we have to find out who's got it, and you have to use a good test for that. And to be blunt, you've all seen in the news, there's some antibody tests that got approved that are probably not worth doing. They're no better than a coin flip. So we are not doing that one. We're doing one with a blood draw that has a much greater return on investment because it's a much more reliable study. A little harder to do, but it's worth the added effort because we can trust the results will help us with public health determinations. And then we have to decide there's a lot more science. What does that antibody positivity teach us in terms of protection? And that's why our hospital and our offices are not changing our protective advice. We're not saying if you have the antibody, don't worry, don't wear a mask. That is bad advice. If you have the antibody, I'm proud of you, but you still need to wear a mask. You still need to be careful because we don't know yet if that antibody will protect you from getting the virus again. And until we know that, our advice to people is I'm glad you have an antibody, but still be careful because we don't know yet what it means. And until we know that, it would be cavalier to do anything except that. You know, we'll know more soon. We have a lot of scientists working on it, but we don't know it yet. So it's a little important to add on to a lot of what needs to be learned about the COVID-19. You asked for a second ago what we're doing to follow up, and I think that's been part of this whole issue. So we have actually put a team together of calling every patient upon discharge, and we want to make sure that when patients leave the hospital, they stay safe and that they continue to recover. So we've been reaching out to all the patients who are discharged from the hospital to see how they're doing, see what their recovery looks like, because we want to continue to track this and to see how they do, both short term and then in an intermediate time frame, because there's so much we don't know. And we shouldn't take things for granted and just say, oh, we've got this, because that would be foolhardy to do that. This is a new virus and we need to be very vigilant about it. And I'm really happy to be part of the conversation today, because I think groups like yours are really helping us have an opportunity to get this information out to the community. So I thank you for that.
Well, Doctor, we have one last question. As community members start to visit hospitals and doctors' offices again for routine medical issues, what should they be looking for to ensure their safety?
So there are probably three things to look for right away. The first is, are the offices practicing social distance? Do they open the doors and let the waiting room get full? That would be a bad thing. So the idea is to make sure the chairs are separated from each other and maybe the office hours are staggered. So are they doing office hours some in the day, some in the mid-afternoon? Are they keeping the offices so they're not congested? We're going to be looking at ways to do that by staggering office hours, by probably having weekend hours, later in the evening hours, so that we're not congesting patients like in the days before our new normal, when you sat in the office and chatted with people. We actually don't want that to be happening. So making sure that the chairs are separated and that the offices are not congested. Making sure that the staff is wearing masks, making sure that there's ample hand hygiene gels readily available. You want to make sure that you're watching people use that gel and cleaning their own hands and cleaning the office handle, hand door handles, etc. So you want to make sure that the office staff is practicing good viral containment, which is social distancing, masking, and hand hygiene are the big three areas. So I think any one of those and all of those together are the kinds of things that we have to be doing in order to observe what has clearly been laid out by the CDC and by the scientists as things that we need to do in order to contain this virus and mitigate it. And for us to keep that containment and mitigation under control, that's what you should be looking for in the office practices.
Okay.
And
Well,
that's what we're certainly advising patients and staff. It will be a while before we return to whatever the new normal is. And, I think this region of the state, and certainly New York City and Westchester, have a lot to be proud of. If you looked at what's gone on in terms of flattening the curve, this state has done a phenomenal job. And, the state health department and the local health department and the governor's office have just been nothing short of spectacular in terms of how they work together with the hospitals and with the local communities to try to respond to this. And they have been very thorough and very thoughtful in how they've responded both acutely and in their planning for opening up the state and opening up for clinical practices and additional care. And we plan to make sure that we all work together to follow that lead. There's a lot more to come. It's not going to be back to business as usual rapidly, but we'll get back to business safely and as usual as we can. Our new normal might look a little different, but it'll be a safe and healthy new normal.
So this, thank you for partnering with us on this. I think Westchester Medical has been supporting and had a close relationship with the African American Men of Westchester for several years now, and it really is our pleasure to continue fostering this relationship with such a prestigious organization, but an organization that understands the importance of partnership to create sustainable health. And in dealing with both Hassan and Professor Bowman on this initiative and our brainstorming around other initiatives that I'm sure we're going to be reaching out to Dr. Garrick and eliciting her continued support for in the future. So we are just thrilled to put on this briefing, and we look forward to opportunities to partner in the future. Thank you.
Thanks again, Matt. Happy to be involved.
Thank you. Dr. Garrick, thank you for sharing your knowledge and expertise with us today. Your straightforward and factual-based responses were clearly communicated to our community members, and we thank you for your time today. Thank you, Mecca Santana Mitchell, for your support and assistance in coordinating this, our initial informational forum on COVID-19. AAMW is planning additional forums on COVID-19 and other community-related issues in the very near future. Please follow us at www.aamw.com.